All right, 7:35, as we do every Friday, bringing in Dr. Syed Hussain from Trinity Health of New England to talk about the pandemic, how it is going here in Connecticut. And of course, Doctor, we've got both the Omicron variant and the Delta wave to talk about, so a lot to get to. First and foremost, thank you. Good morning. How are you today? Oh, dear. Doctor, I think we can't hear you.
I'm right here.
There we go. Okay, we got you now. All right, first things first. I know a lot of people worried about the Omicron variant, even though it hasn't popped up in Connecticut yet. Of course, the two things we've been waiting to find out, the transmissibility and the severity. Said give it a couple of weeks. We're about halfway through. Have we figured out anything at this point?
Not yet, Tim. So great questions. We still await data on both how contagious it is, although I will share a data point with viewers that given what's happening in South Africa, just to give you an idea, last month, 1 month ago, early November, South Africa was averaging a little under 300 new cases a day. It has now gone up to, as of Tuesday, it was 4,500 new cases. And as of yesterday, it was 11,500 new cases a day. And the Omicron variant is on track to becoming the most dominant strain in South Africa. So it just gives you an idea that, yes, South Africa does have low vaccination numbers, but at the same time, this is likely a much more contagious variant, given what we know so far related to mutations and all that. What we don't know yet is, does it also lead to more severe disease? And how does it stack up against vaccines and currently licensed treatment?
Of course, there have been travel bans put in place in various parts around the world. Are those going to be of any help, or given that it's popped up in so many countries, is the horse out of the barn at this point?
Travel bans are usually not very effective. They give us, at best, a little bit of time so that we can prepare, we can study, we can look at this new variant and how it will interact with our vaccines, therapeutics, testing, and what we need to do to better prepare ourselves to prevent another surge. But travel bans usually don't have much impact. We already know there's
Doctor, are you there? Sorry, we lost Dr. Hussain. Oh, there we go. We can hear. All right, let's move on to what we're dealing with here in Connecticut, Omicron aside. This is our, as you know, respiratory viruses really tend to surge in the winter. This is our first winter with the Delta variant. Numerically, I can tell you, we're seeing hospitalizations and deaths are a lot lower than they were this time last year, but boy, are cases spreading quickly. What is your take on how we're dealing and what we're seeing with the Delta variant?
So a couple things. What's really different compared to last season is that we have very safe and effective vaccines. If you're unvaccinated living here, please get vaccinated. And if you're due for a booster, you need to get a booster. So if you got your Moderna or Pfizer second shot before January 3rd, then it's time now to schedule that appointment to get a booster, because that's going to keep you safe.
But just how widespread do you see the Delta variant getting, given our sort of vaccine coverage here in Connecticut?
So I'm guardedly optimistic, Tim. I think we're among the top 5 states in terms of vaccination. What gives me a little bit of pause is booster. We still need to get our arms around the booster campaign and make sure that individuals roll up their sleeves and get the booster, because we've seen waning immunity. So if enough people don't roll up their sleeves and get the booster shot, then we're probably back to square one. We're going to see a rise in positivity, infections, and hospitalizations.
I don't know. It's kind of odd trying to figure out exactly how covered Connecticut is as a whole, because we used to look at this as a binary thing. You're either vaccinated or you're not. But now that we know there's levels of immunity because things can wane, just because the percentages of people fully vaccinated are going up, that doesn't necessarily mean the protection's going up if a lot of people's immunity is waning. You know what I mean? Are we just essentially seeing a real-time experiment on vaccines waning immunity based on what these numbers are, especially with the positivity rates in Connecticut?
Yes, but if you do a drill down into who's getting hospitalized in Connecticut, a large chunk of them, more than 75% of patients that are admitted currently in the hospitals in a severe acute condition are unvaccinated. So it goes back to that same premise that if you're unvaccinated, please roll up your sleeve and get vaccinated, because now we have not only Delta to deal with, but possibly a more contagious rapidly spreading new variant called Omicron.